Okay, so in this new intake packet that we are creating for the facility, we are also creating a form that explains what exactly the Code of Ethics is for Three Mountains Regional. And what this will do is basically give our patients an outline of the ethics that we hold our staff to. And this will be really helpful for those who have concerns about their health care, privacy when it comes to their medical records and their information, and how exactly they need to go about billing and what they expect out of our staff. It kind of hit this intake form. It's going to hit a lot of points of our code of ethics packet that we give to our patients. It's also going to be really important to be sure that they are aware that each employee in our facility receives this packet, and they acknowledge that they are aware of the ethics that they are held to. Patient relations is something that we want all of our patients to be aware of. They need to be treated with the respect and dignity that they have. They are asking for care of us. As us with staff and management, we should provide them the care that is appropriate and that is heartfelt. We should never discriminate based off of their race, color, sex, religion, whatever their personal beliefs and their choices are. It should not affect how we deliver health care, by no means. Patient safety, this is basically going to revolve around the safety of their medical information in hazardous spots in the facility. That can include, preventing a fall risk, someone tripping on like some water that's on the floor. Everyone is held responsible to that. It's not just environmental services. We are all held responsible, for the safety of our patients. Physician activities. This basically goes over what the physicians are obligated to the patients in our facility. We want to try and keep that physician-patient relationship healthy, and be sure that, our patients know that our physicians, don't benefit from referring out to others, and they, don't, receive anything when, they're referred to us. So that's going to be very important to let the patient be aware of. Also, we need to let them know about how exactly we go for billing for the services that we have provided to them. Our billing department is very big about presenting accurate billing to all third-party payers, whether it's Medicare, Blue Cross, Freedom, United Healthcare, Medicaid, whatever payer it is. We prohibit our staff from stating false information to get higher billing reimbursements. The last thing that we want is to call a patient and say, oh, well, now you have to pay a certain amount of money because we billed it wrong. That's just, it wouldn't be necessary. It wouldn't be, a good situation at that point. Political activities. Everyone is entitled to their choice, whether they are liberal, Republican, Democratic. However, that has no effect on patient care. For instance, if I, am a Republican and, our president, is a Democrat, that shouldn't affect how we treat you, how we decide about your diagnosis. We are not going to discriminate based on what political party you choose, and we won't deny you care from the party of your choosing. We also do not receive any funding or resources from any campaigns, parties, organizations. We don't receive any funding, any help from presidential candidates when it's time for the election period. Conflict of interest is something that we really push for in the facility. We don't want a friend of a friend to make decisions for you. We don't want Johnny's girlfriend, who is a nurse, taking care of you because, you know, Johnny's choices could influence, you know, his girlfriend, the nurse. And we don't want that to be an issue for our patients. If this is something that becomes an issue, they would need to speak with the nursing supervisor that's on that floor, and we would be able to get you different care, have a different, you know, physician if necessary. We would need to do the appropriate steps to be able to do that for you. Communication. All of our staff understand that any communication devices, whether it's computers, email, internet, voicemail, any type of communication, it's only used for business purposes. We understand, you know, our staff does have family of their own. However, we try to keep that personal part at a minimum. Also, we do not allow our staff to, you know, use any type of social media, whether it's Facebook, Twitter, Instagram, Snapchat. We do not allow that while they are working. And if, you know, we see any type of behavior that, you know, states patient information, you know, while they're at work, we do address that immediately. Privacy rights, this deals with patient information. We want, you know, our facility to collect that information because that's needed. We need to know, you know, your medical conditions, past medical history, family history, what medications you're on. For one, that makes a difference in your care. We will be able to provide the care that we need to give you if we have the appropriate information. Some, you know, of our patients are kind of iffy about giving that information because they don't want everyone to know about that. But because of HIPAA, we're not allowed, it's illegal basically, so, you know, give that information out. Our staff is never going to disclose any confidential information to you. It violates the rights of the patient. And we want to be able to make this a safe environment for our patients. We don't want to go and, you know, tell, you know, personal, private information to others, because sooner or later they're going to pick up on what's going on. So this is a big thing for our facility. We want to be able to be sure that patients are comfortable, they want to come here, and that this is, you know, the facility that they want to be treated at. We want, you know, our facility to be the first facility that they choose. Excuse me. This form is going to be in our new intake packet that we give to all of our patients, regardless of you know, if it's for radiology or if they're being admitted or a same-day surgery. We want them to have this put together. We want to give them an idea of what our staff is held accountable for. Again, this packet is going to be able to help, excuse me, help our patients be able to understand where our staff, at the level that our staff is made.